Hi guys, so quick health update. Yeah, no makeup, hair not brushed, but it's gotta get it done. So yesterday, I was the end of my wonderful hiatus of not doing any appointments. So I went to the clinic to have the biopsies done on a lymph node that's suspicious and um, the tumour that was inside my breast. Now, the tumour is just a little over an inch long. This really concerns me. As you can see, really not much. But I can, even knowing where this lump is, I cannot find it. The specialist, even knowing where the lump is, also struggled to find the lump. So we as women we're always told, to check, do once a month or whatever. But with someone with virtually nothing, you would think a lump, an inch, I would notice. And not only did I not notice, even knowing where it was, I could not find it because it's set back near my ribs. So the only way to find things like that is mammograms and ultrasounds. So don't get too self-assured because you can't find it. It doesn't mean that there's not one there. So if we're in that age group where we do screen, then go and have that screening done, because it doesn't. You would think an inch tumor in someone that's almost flat-chested would stand out a mile, and it doesn't because of where it's set. So that was actually a bit of a shock to me. I have been through this circus before, about 18 years ago. Thankfully, after the biopsy time, I asked if I could do an alternative, and when I'd do the follow-ups, and it cleared up. This one, because I've got so many different problems everywhere, I just don't have that physical energy to go, okay, I'm going to be okay, because I just don't. I feel like following a medical, even though I'm still doing alternative, is a good idea. So there's the lymph node one was just a fine needle, and took a couple of cells out of it. The tumor, they actually did do biopsies. The sound of the machine they used to get biopsies done out of the tumor, it sounds like, when you get your ears pierced and there's that click for getting your ears pierced, that's what it sounds like. Now, they use a lot of local anesthetic, so you feel a bit of pulling, but you don't, it's not painful. If there's any pain, you mention it, they will give you more to numb that area, because they do need to get quite a few out to test, not only in the tumor but the surrounding area, to check that it hasn't spread. It does take a lot longer than you think. You think, oh, it's 5 minutes, 10 minutes, but no, we didn't get out of there. Our appointment was at 9, and it was nearly 12 before we got out of there, and that was just an appointment with the doctor, and the biopsies. But the glue that they used to cover it up, for the like little band-aid thing, is seriously like super glue. I've showered, I've scrubbed it, and I'm still peeling glue off from that. Bigger one has got stitches in, so that one can't come off yet. I would say the ache is in my because this shoulder was frozen for a lot of years. I had acupuncture to release it a couple of years ago, and the pain is actually in my arm and going down my arm and not in the breast area as you'd expect, because you have to have your arm over your head the whole time while they're doing it. So not trying to put anyone off, because it was pain free. Yeah, it took time, but there was something going on all the time, so it's not like you're just sitting waiting. That's the hard time, when you're just waiting and waiting. It wasn't, there was the appointment, then there was this, and then there was that, the ultrasound, and so that time just flew past, because it wasn't just sitting twiddling your thumbs waiting. But my main thing I want you to if you take anything from this video, just remember, you may not feel it. So if you're ever at that age group, because I'm 57, if you're at that age group where you can be screened, do consider it, because if it's near your rib cage, or somewhere that you're not actually touching, you may not feel it. Okay, I get my results on Monday, and then we have a plan for moving forward for what's going to be done and how it's going to be done. We have the advantage of knowing from the other cancer that I react really well to radiation and chemo, but we'll have to see. A big part of what will happen moving forward will be if the lymph node is infected. It actually is infected with cancer. That will be a bigger issue than if it's just the tumour. So, but until we talk to them, I don't know. So I will keep you up to date. As far as in myself, I feel fine. I absolutely loved having that little bit of time off. That there was no doctor's appointments, no specialist appointments, no treatment. It just allowed me to get back to myself, and I had my friend's dog come and stay, and it was just really nice not to be at everyone else's beck and call. My phone wasn't ringing from the hospital or receptions or doctors, and that was just really nice. So I'm still feeling upbeat in myself, but that's probably because they haven't put the treatment plan in place yet. So I'm going to enjoy my next few days till I get my results, and then go from there. And it is what it is, and you just accept it and adapt and work through it. Okay, take care, guys, and I will keep you in the loop. This one I'm definitely not as worried about as the other one, because the other tumour was a lot bigger. And I will stay healthy. As you can see, a lot of the swelling's gone down nearly, and I'm almost looking like myself again. So I'm quite enjoying looking like myself, rather than a pregnant gerbil. Okay, guys, take care. Talk soon. Bye.